My name is Vivek Srivastava. I am the co-founder and CEO of HCAH. Globally, there are 1.4 billion elderlies across the world. In India, the elderly population currently is around 15 crore and it's going to become about 20 odd crore by 2030. Now, this is a big challenge in the country. While India is a young country, but we are the second largest elderly population in the world, and hence that becomes a big opportunity as well as challenge. If we don't act on the elderly care, then we'll have a massive gap where we'll not be able to address that market, and that's where there's a lot of investment which is needed in this market. The market would be about, in the total rehab care market, the geriatric market is the fastest growing. Out of the overall 35 billion geriatric or out of the 35 billion rehab market, 35% would be the elderly rehab by 2030. The opportunity for the geriatric market is humongous. As you would know, we got economic liberation in the late 1990s, and that's when people who were in the youth now are turning to become 60 plus, and more population is getting in the elderly segment would have money to spend, as well as because of the changing situation in the society, people are becoming more independent and are not dependent upon their kids, and hence there is a great opportunity available to address that need. Now, for addressing that need, we have to make specialized services available for the elderly. We started in 2012 as Healthcare at Home, a home healthcare company, but over the last 10 years, we have transformed ourselves into an out-of-hospital care company. How do we define out of hospital? Out of hospital is where you don't need a super specialized infrastructure to deliver the care, or a super specialist physically present to deliver the care. A large part of this is also in the rehab market, which as of now is going to become a $30 billion or $35 billion market. Now, within this, the way our journey progressed was we started as a home healthcare company. In the process, we moved into doing chronic disease management along with pharma companies. We are the largest player there. Then we started in the rehab market by the acquisition of Suvitas, which we did in 2020. And since the acquisition, which was 100-bed centers, we have moved into about 250 beds. With now about 5 centers. And very recently, we also acquired Seniority, which is India's largest geriatric care platform. And that, I think, is, with this, we are trying to address the huge opportunity available in the geriatric space. We acquired Suvitas in August 2021. Suvitas was the first company in the country to do transition care, and with the market leaders. When we acquired Suvitas, we didn't have a center-based service model available, and they had about 100 beds across 2 centers. Since then, we have increased the number of centers to 5, and now we have about 250 beds. And with that, we have been able to address a big need in the rehabilitation and recovery segment through our centers, where we deliver care to a lot of population who have stroke, accident recovery, and other diseases, for primarily 3 big buckets of services: inpatient rehabilitation services, long-term acute care services, and skilled nursing services. And about 60 to 70% of our patients here are elderly. So this again has been able to provide another service available to the elderly at a much reasonable cost as compared to what you would spend otherwise if you stay in the hospital, and it also increases the access. So you don't have to get into large hospitals where it takes a lot of effort and time to go inside, but these are more home-like facilities where people feel that they are in a home-like surrounding while getting clinical care. We recently acquired Seniority, India's largest geriatric care platform. It basically currently services the customers who are elderly in nature for their e-commerce needs or products needs primarily, and it caters to a large segment. We have about 3 lakh visitors coming on a monthly basis, and caters to population all across the country. And hence, there is a huge need in the market for the elderlies to get these kind of products, which are generally not available, especially in the tier 2 and tier 3 segments in the local market, and that can be delivered directly to them. By the year of FY24, we would be having about 750 beds, which were about 100 beds when we acquired Civitas in the transition care segment. Also, we would be increasing our Seniority service portfolio to improve a lot of specially designed products for the elderly. In that, we would also get a lot of products which are our own brand, our own label, so that we are able to get it at affordable rates as well. The other thing which we also do is open a number of stores across the country for Seniority, so that the elderlies can actually experience a lot of products by themselves before buying it. In the next 5 years or so, we want to become the largest out-of-hospital care player with, of course, the largest geriatric platform in Seniority. In terms of transition care, we want to have about 2,000 odd beds in the next 5 years, which again would be the largest, by far the largest player in the country.